I remember talking to this doctor, and I guess it must have been the way I was explaining my symptoms. And he just said, I believe you. And I remember I exhaled and I started to get tearful in a way because I didn't expect to be believed. I felt like I had to present as the model patient in order to be believed. I'm Dr. Loree Johnson, therapist, trainer.
I have Dr. Loree Johnson on with us today to talk about understanding stress, trauma, and loss.
Dr. Johnson is a licensed marriage and family therapist.
We are joined by Dr. Loree Johnson.
When you're interfacing with these systems, I always advocate for my clients, come with a list of questions, have somebody on the phone. They can be the note taker, they can help ask questions and clarify. And if for some reason something is not being documented or you feel like your question is not being answered appropriately, asking, why aren't you answering my question? I'm really scared as a Black mom for the day that he experiences or understands that he's experiencing racism or discrimination. That balance that I hold with knowing that I want to raise a little being who deserves every opportunity in life as his friends, as any white person would, knowing that is going to be different in some ways. I would have more grace for my struggles, and I would prioritize fun and joy in ways that I didn't before, period.
Hello, Dr. Loree. How are you?
Hi, Natalie. I'm doing well. How are you?
I'm well. It's so great to see your face and to catch up with you.
Yes, it's good to see yours too. It's been too long.
So much that I want to talk to you about today. So I'm going to jump right in, okay?
Okay, let's do it.
So you were recently diagnosed with ADHD. How did that impact your mental health and what you thought you knew about yourself?
That's a great question. And it was a real shock. I think the journey to the diagnosis was just as challenging as the diagnosis itself. And I can't talk about having the diagnosis without talking about just where I am at this stage in life as well, being perimenopausal and the hormonal shifts that we go through as women. And so I had this very wild kind of experience that felt kind of traumatic to me. This is probably a little bit over a year before the diagnosis. So I thought I was kind of having this trauma reaction, and it subsided. But I had noticed some things happening with my body that I still didn't feel right. And so I met with my doctor, and we tried out a couple of medications, and one of them was an ADHD medication. And I decided there were some issues with sourcing. I didn't feel comfortable taking medication out of someone's hands that had, the actual diagnosis. So that was when I decided to talk to a psychiatrist because she's like, well, should we try something else? And I was like, well, I've had this history of anxiety and depression. I really think I should talk to, a psychiatrist about this just to be on the safe side to make sure, I'm not having another anxiety episode or depressive episode. And based on that conversation, and I could tell by the questions that she was asking me that she was diagnosing with ADHD. And I literally said to her, I was like, are you diagnosed? Is this my diagnosis? And she was like, yeah, you fit the criteria. And I know it's a little bit kind of unconventional around how people usually get the diagnosis, but for me, it felt like a mixture of feelings. I felt relief because there's some things about my life historically that made sense. And then I felt this overwhelming sense of embarrassment as a mental health professional because I felt like I should have known this, so to speak, even though it had been on my radar maybe for other people. The way that my presentations of symptoms had always been framed had been through this lens of anxiety and depression. And I think that made sense for, the time in which I kind of grew up and also kind of grew up in the field of, and what we know about ADHD and neurodivergence has just shifted dramatically over the last like maybe 5 to 7 years. And so here I am. And so it has really changed how I know myself, and it's changed how I work with people now because I think that I'm obviously a lot more attuned to the diagnosis and asking for that or asking questions around that. I think just my work with in the reproductive health had maybe narrowed my focus to a degree, and that covered with my own kind of journey, which we'll probably get into in general. It really colored how I approached diagnosis or just the clients that I would see, and so it was a very big learning curve. I didn't expect to be going through this at this stage of my career, and I know I'm not the only one, but it's been wild. It's been mixed and lots of mixed feelings, and yet a lot of relief and understanding.
You and I have spoken a tiny bit about being a part of the lost generation, right? I feel like
Yes,
we
yes,
are the generation where we didn't talk about so many of these things, from reproductive health, women's health challenges, and just norms, right? What is
yes,
normal?
yes,
And neurodivergence even, right? Like now these topics are much more widely discussed, and in part because of the conversations we're having, but also when you get back to the neurodivergence in particular, it's interesting about how we're being diagnosed
yes,
later in our lives. Like we're not in our
yes.
teens or our 20s anymore. So
Right,
so
right.
when that happened, did that you said you were relieved.
Yes,
You
yes.
said that it was also a little confusing. What was that sort of knowing what you know now? Like
Mhm,
what did you miss that you felt
mhm.
like what did you feel like you missed?
I felt like I missed an educational and social understanding of myself through a different lens. And as I do what a lot of us call maybe time traveling, once you get the diagnosis and you start reflecting on all of these moments in your life that didn't make sense. And so when I think about my scholastic experience and I think about the numerous times that I spent daydreaming or how I had trouble, in certain subjects or completing assignments, and how I learned to compensate, and how that could have been different. Maybe if I had known that I had, and I still haven't had any kind of formal testing around, what my learning differences might be. I know that I daydreamed a lot. I know I have a lot of issues with like reading comprehension. And what I would end up doing is I would spend a lot more time. I would spend these hours upon hours of studying, and that became my life. And in a sense, this pattern of, I had to delay kind of gratification or just joy and play because I'm like, no, I have to study. And there wasn't really this balance. And then also, what some people might be surprised to hear is this sense of social awkwardness that I would experience too, and not always picking up on certain cues, and or just maybe thinking about things a little bit different that just made me feel more like an outsider. And so just the shaping of that experience could have been different. And so, yes, being part of this lost generation or kind of a lost part of the lost girls, as we're kind of referred to, is because, historically ADHD was considered an issue that primarily in fact affected boys. And you think about the H being the hyperactivity, that stood for hyperactivity. And what we know about that, it's not just a behavioral hyperactivity, it can be an hyperactivity with the mind. And so the ruminating of thoughts, and that is another, I think, kind of presentation that goes along with that. So there's so much diversity within within that the community. And I know that I'm still learning, and but yeah, that's what feels like could have been different. And then who knows, maybe my professional trajectory might have been a little different because, I started off as wanting to be, a psychiatrist and, pre-med, and then organic chemistry kind of disabused me of that notion and, really humbled me very quickly. But I learned to compensate. And so in some ways, I think being where I am, I'm incredibly proud of where I am. And also, I think it's been a very painful road that didn't have to be as painful as it was had I known. And having that perspective could have helped me prepare differently.
So, what are the things that we could be looking out for our own children when we are looking at this? Because so much of what you are sharing, by the way, resonates personally. So I'm like, oh,
Mm-hmm.
I feel that. So I
Yeah.
actually, part of me, again, my own mind is doing its own, cartwheels, thinking, okay, that is so fascinating. I would venture to say boldly that more people are neurodiverse than perhaps not. There just has
Mm-hmm.
not maybe been as much research around it and
Mm-hmm.
against
Mm-hmm.
knowledge, but again, like, that's an opinion and I have no
Right.
idea. So
Right.
going back to, my question for you is what is something that adults can be looking out for their kids that we didn't know to look out for, particularly for the non-hyperactive element of ADHD, in which we can support our children not just learn to cope, but to hit their best stride from the beginning?
So I want to preface this by saying I mean, I have definitely have some thoughts, but I do feel like I need to preface that I am not an expert on ADHD or ADHD in children, and so I think consulting someone who is extremely important. But I do love that there's more information that is out there to help us understand and to go to the professionals who are experts in this part of the field. I think some things to kind of, to be aware of through my own experience, been more about um, daydreaming, distractibility. And when the kids are younger, I know that, there are a lot of attention issues, and there's some things that people might start to see. Kids might be having difficulty, sitting still if they're boys, or it's getting distracted, in general. And when the work starts to get a little bit more difficult, I think in elementary school, and when you start to notice that kids aren't necessarily able to maybe thrive in the classroom, that might be one area to kind of look at and explore where are some of the challenges happening in class, and there are issues with following directions, are there issues with following through on tasks? Do tasks need to be kind of broken down in a way that are easily understandable? Another, I think, the emotional experience of the child. And are there kind of these overwhelming and kind of pervasive experiences that are resonating in ways that are really challenging? So how's the child feeling about going to school? And how are they feeling socially and getting along with peers? Are there some extra sensitivities that just feel somewhat outside the norm, so to speak? Do they have friends? Are they what does their socialization kind of look like? And I think those are some initial clues to kind of think of, and then maybe talk about with somebody who is more experienced, and an expert in this.
I think that having lived through it and
Mhm.
living through it as you are deems you to be an expert from an experience perspective, even though
Yeah,
you may just be finding the words to frame that, which,
yeah. Thank you.
all of it is important. You are a therapist specializing in reproductive mental health for women and families, particularly those who have gone through loss and infertility. And, what inspired you to support women and families who have gone through or are going through infertility and loss?
The inspiration comes from my own experience and having had a protracted journey to build my family. I just remember really early on, maybe about 2 years in to what was an 8-year journey to welcome our quadruple rainbow baby. And I know you know the story, Natalie, but your listeners might not. But I was pretty naive when I went into, the journey. And I think that naivete was part of how our reproductive health is taught in our communities, and also the messages that we get from the medical community as well. There's really not a lot of great education around how to get pregnant. We're taught mainly I was taught, and mainly people in my generation were taught how to not get pregnant. And that sprinkled in with stories of hearing other people who, might have gotten pregnant later in life, and this messages like, "Oh, it's no big deal." There are women who are getting pregnant, or people who are getting pregnant in their late 30s and early 40s. So you've got time, and that wasn't really the case. And so I found my husband later in life, got married at 38, and thought, "Oh, okay, well now I'm ready, and I can just, we'll just have intercourse, and then I'll have, well, it'll be fine." And I think back and I'm just, really jarred by that. But having had, and then I've had a couple of losses initially. And when I was starting to think about just where to go for support, and realizing as a therapist how much I was having trouble finding somebody to support me. And even though I'd had a long term therapist at the time and she could hold some elements of the experience, my second loss was what's called a termination for medical reasons. And that is another kind of trauma, reproductive trauma in and of itself, because of the stigma that's attached to medical abortion, and then also the stigma that's within the lost community around ending a pregnancy that is very much wanted. And so there was another complicated layer on that experience that I didn't feel very held by. And that, coupled with not having a lot of people to talk to in my cultural community, it was really a very dark and exhausting time. And I remember saying to myself, if I am having this much trouble, what is it like for people who aren't as knowledgeable about the therapeutic community? And so I always had that in the back of my mind, that once I got through my journey, that I would want to support others in ways that, in a more comprehensive and integrative way, that in ways that I wanted to be supported, or that would have been helpful to me.
How did you support your own mental health when you were experiencing your own pregnancy losses
Yeah.
and
So
challenges?
yeah. So it was really trying, because before I maybe officially shifted my practice to include reproductive mental health, I was kind of already working in the field peripherally, because I had people who were going through their own losses and trying to get pregnant, and also having people who were going through fertility treatments as well. So, and these were long-term clients that I wasn't going to be like, "Oh, sorry, I can't see you anymore." There was the relationship was
Right.
there. So in some ways, it was, again, a very, I think that was also part of how challenging that and dark that time was, because it's managing my own loss, and also really trying to make sure that I was able to find support in ways, and keeping that part of my practice very small. And so I didn't take on any new clients that sought me out for maybe pregnancy loss, or fertility, help with fertility, but I just made sure to structure my day a certain way. I had to be very mindful of self care, and also taking lots of breaks. And those breaks took the form of travel, because I needed some distance from the work, in addition to, kind of being held therapeutically. So it's almost like I had all of these streams of support, and which were helpful, and at the same time felt a little disjointed, but I was able to make it work. And so, and even for, my termination for medical reasons, I actually had a support person who was across the pond in the UK. And before, I even heard other therapists talking about terminations. And so she really walked me through a lot of early parts of my grief. And I'm still so thankful to her and think about her, because I could, yeah. So that was part of just how I piecemealed things together, and being able to support myself and also support my clients.
And you have been an incredible source of support for reproductive health for women and families for as long as I've known you, which is actually kind of feels like a while now. Because,
Yeah, it's been like 4 years.
yeah, but you have been talking about this and supporting and holding space well before this was mainstream discussion in
Mhm,
insofar as infertility and loss was concerned.
mhm,
One of the things that I remember thinking that was so important and impressive when I first met you was how you particularly held space for women of color.
Mhm.
And I think that, you raised it a little bit earlier about how there's this stigma associated with infertility to begin with.
Mhm.
And then secondly, there's this other stigma in particular for groups, of women of color. So can you
Mhm.
explain a little bit about that need to
Mhm.
support that community? Because it's so important and maybe a little different because there is still a bit of a stigma that maybe even lags behind the stigma that is being lifted from the general population.
I think it's also important to note, that the experiences of women of color are people of color who are trying to build their families is incredibly diverse. And so you have the, maybe Black American or African American experience, you have the Hispanic and Latino experience, and you have the Asian Pacific Islander experience, and also the Native American experience, and a whole host of other experiences that we still don't know a lot about. And so even though we might try to talk about these collectively, there's so many nuances within each of those groups that I think we need, that just, deserves some space, because what we know is that there are disparities in health outcomes in general between, all of those groups of which I am a part and our white counterpart. And there's systemic barriers to care that sadly are unique to the US. And one of the things that, has become a huge interest of mine is really understanding the concept of weathering. And that's a term that was coined by Dr. Arlene Geronimus, who we have to kind of thank for that. But it's the kind of study of cumulative stress and the impact of sustained stress associated with racism and discrimination and its impact on reproductive outcomes. And so we know that, and the data that we're seeing between when we compare kind of like even our pregnancy outcomes here in the US, our maternal mortality rates here in the US, and when we see our counterparts abroad that are actually thriving with less resources than what we have here, that really confirms that this is really a distinct US issue. And for us to think about that, I mean, discrimination in general, racism in general leads to poor outcomes, in terms of fertility, in terms of other health issues like diabetes, hypertension, heart disease. And when we just don't use or utilize our resources to invest in our communities and to allow for that investment equally, this is what starts to happen. And so I think it's so important for us to have these conversations to raise awareness, because sometimes we tend to think, oh, well, if we just take care of ourselves or eat better or exercise, then, we'll have these outcomes. But I
Right.
don't think people realize that with my level of education and access and privilege as a Black woman, I am still 2 to 3 times more likely to have an adverse reaction for birth. And so going into that and knowing that having my son, that, I was just at greater risk, and I had pregnancy induced hypertension. I had insufficient cervix, and then I ended up having a, ruptured uterus towards the end of my pregnancy. So lots of different kind of moments and stressors that disproportionately impact people who look like me. And so I think that is what keeps me, kind of going and trying to raise awareness and talk about this. And also to remind people that this is something that's unique to us. So that information and that experience is what keeps me going to make sure that, we're doing whatever we can, and me meaning me, me as an advocate and other advocates and other organizations that I might kind of work with to help just raise awareness, but also to build other support networks and community levels of care to address, some of these disparities in ways that our medical systems and communities aren't in a larger capacity.
1,000%. And can you share a
Mhm.
little bit about some of the stats associated? Because I'm aware that there's a higher maternal mortality rate associated with women of color, particularly Black mothers.
Yes.
And if you could share some of those stats, I think it's really important to uncover the issues at hand, because I don't know that people, again, are really as aware of it until these incidents sort of hit the media.
Black women and Black birthing people are, 3 to 4 times as likely to have an adverse, outcome, and sadly, I think 3 to 4 times as likely to die in childbirth, or twice as likely to suffer from pregnancy loss than our white counterparts. So these are, those are two just like off the top of my head that that really highlight the difference here. And so we know that, just with access to care, how even pain, or how diagnosis is even handled, within the community. There are lots of implicit biases that are just rampant within our systems that contribute to those outcomes. And if you think about someone like Serena Williams, or Beyonce, who are probably more of these notable individuals who've had some pretty intense challenges, and with Beyonce having, multiple miscarriages, and thinking about Serena Williams and when she had her first child and she was really struggling to recover, and her symptoms weren't taken seriously and she almost died. And so again, somebody who has all of the access to resources, it doesn't protect them from having adverse outcomes. And that's the part that I think is hard for people to understand.
And let's go back a little bit to the education element. I
Mhm,
recall at one point reading a study that was done, believe it was at the University of Virginia
mhm,
in or around 2017. It
mhm.
could have been 2016. And I remember being floored because it was a study, and I think a focus group that was taken from University of Virginia medical students.
Yes, that was 2016, and,
2016.
yes, yes.
Was it like
Eh,
60 or so percent?
mhm,
Correct me if I'm off here. 60 or so percent of the medical students polled believed that people of color had a higher threshold to pain,
right.
which
Yes.
blew my mind, and
Mhm.
quite frankly was and is very upsetting.
It's incredibly upsetting to think about a profession that we rely on, being impacted by bias to such a
Yeah.
degree. And sadly, yes, that is accurate. If it's not 60%, it might be like 56%. But I think regardless, more doctors than not have this belief. And surprisingly, and that belief that pain impacts individuals differently, and that will impact like how they actually prescribe pain medication or take that seriously. And so I also have some kind of experience with that as well, because my mom has sickle cell disease, and she has a derivative of the disease that is maybe not as intense as like full blown like sickle cell anemia. I think it's called the SC derivative, but regardless, she presents with crises from time to time. And I can't tell you how many times I have accompanied her to the emergency room where she's been complaining of pain, and I can hear and I tell by how the nurses or doctors are interacting with her. They classify her as drug seeking, or they will withhold medications that we have known to work, and especially if we ask for them or what have you. But they're like, no, we have to do it this way, or and you can tell they're just not experienced with it, with the disease. And then also, I'm sure that there's some biases around that too, because once you're flagged as somebody who is quote unquote like a frequent flyer, that's kind of a negative connotation. But terms that we've heard, used and seen in her chart reminds us that these are humans with biases that are where those biases are subtly impacting how care is delivered. And so I have always carried that around with me. And I remember going to a doctor, few years ago, and just how I have to kind of show up differently. And I remember talking to this doctor, and I guess it must have been the way I was explaining my symptoms to me. And he just said, "I believe you." And I remember I just I exhaled and I started to get tearful in a way because I didn't expect to be believed. I felt like I had to present in a way as the model patient in order to be believed. And so, that is tied to, I think, these experiences that mom's experienced firsthand that I've witnessed through her, heard other people in my community also talk about. And that's what we hold and we carry around when we think about how we have to interface with the medical system.
So, how do you advocate? How
Mhm.
do we all advocate and support? And what needs to change? I know that this is deep rooted, but
Yes.
how can we change?
Yeah. So advocating, partly is about education, and I'm continuing to educate myself, and I encourage other people to educate themselves. So continuing to listen to people like me and other advocates around reproductive mental health. The Broken Brown Egg comes to mind as a huge advocate. Sisters in Loss is another platform where there's a lot of information about reproductive mental health and loss within the Black community. And sadly, I don't see as many resources for other kind of communities of color, even though I'm still on the lookout for that. And I have a couple on my radar, but I just don't know enough about them yet to maybe recommend. But I think, having information is important. And when you're interfacing with these systems, I always advocate for, my clients and, my mom to, come with a list of questions, come with somebody to, or have somebody on the phone while, to listen, to be a second set of eyes and ears so that, they can be the note taker, they can help ask questions and clarify, and also just to observe what's going on because if a question's not being answered or if there's just something that's a little off, you have that third person there for some kind of reinforcement. And if for some reason something is not being documented or you feel like your question is not being answered appropriately, asking, why aren't you answering my question? Or even if you're questioning the diagnosis, you could start to even ask, why aren't you thinking about other things or what led you to this and not that? Because, a lot of us have these experiences with misdiagnosis as well, and myself included. So those are some ways around education and advocacy that I think would be really important. And then as far as systemic change, I really advocate for people to think about their own biases and continue to be in community with people who are different than themselves. And, because it's through relationship that I think we change. And because I think we fear what we don't know or don't understand. And that's because we don't have any kind of exposure to that. And also, I think systemic change is important. So, how we vote, and I hate to, it's hard not to be political, but healthcare is political with the rolling back of Roe v. Wade and with the health disparities that we see that are supported by these policies and institutions that really create and contribute to the disparities. It's important for us to think about how we are voting and how are we supporting policies that uphold discrimination and oppression as opposed to tearing them down. And so really getting educated about our political system, I think, is another way to address this.
And awareness too, and understanding. You mentioned the re-education that has to
Mhm.
happen. I think
Mhm.
that many people are not necessarily aware that these biases were truly born out of the father of gynecology, right? Dr.
Mhm.
Sims. People don't
Yeah.
understand that that was the education.
Right.
And so if
Right.
there's an awareness that the education came from what was supposed to be institution, right? Like which was supposed to be quote unquote the medical Bible, I think people can say, "Oh, okay, that was flawed from the very beginning." Maybe you could share a little bit about that because I don't know that many people understand the roots.
Think we have to maybe go back even further when we think about how our country was founded and how, and the roots of slavery and the connection of slavery here. And I know that's not a popular topic to talk about, but that's the reality. And so enslaved people were considered less than. This country was based, was built on massacring Native and Indigenous people and really reframing that story around, around that process. And so it really set up this dynamic of one group kind of being superior and really objectifying and dehumanizing, others. And so then you have J. Marion Sims, who, because out of this time of enslavement, there was this belief that we weren't really human, and we were used, enslaved individuals were used as breeding, for breeding purposes, to kind of, to produce more labor to help build the colonies. And so this belief that dehumanization, it makes sense that if you don't see somebody as a person, you don't think that they experience pain. And so therefore, you think that you can do anything to them, and it's not going to be a big deal, or they're not human anyway, or they are but not in the same way. And so that distance, that disconnect, really fueled that idea. And then what he ended up doing was he ended up performing countless surgeries on enslaved women, and without anesthesia, because it was assumed that again, we didn't feel pain. And that's how some of these procedures, and also the medical tools that are still used to this day. So every time any person with a uterus who goes to see a doctor, and has a pelvic exam or a pap smear, you can thank Dr. Sims for the speculum, because that was created based on his work, with enslaved individuals.
Yikes. That is,
Yeah.
I did not know that part of the story.
Mhm.
It's all really rough. It stems all back to that. So I appreciate so much what you shared, because it goes so far back. And I think that it's important for people to understand that
That
the
we're dealing with
tolerance
lack
to
of.
pain,
Mhm, mhm,
right? Lack thereof
mhm.
is what has created this thought process that is even carried forth today. And that is a problem.
It's a problem. It's a huge problem, because I think so many people want to think that we're living in a post-racial society, and maybe with, the election of President Obama, in 2008, and communicated that we have maybe surpassed or kind of moved beyond some of our kind of discriminatory beliefs and practices. But sadly, what has still been there, what this tells us is the threads are still there, and we haven't had really much acknowledgement of that. And I think there's been so much, maybe more pressure to kind of distance ourselves. It's like that was in the past, and slavery, I didn't have anything to do with slavery. This doesn't affect me. But there are remnants of this. So after slavery, there was Reconstruction, and then there was Jim Crow, and then the civil rights movement. And so when you think about the fact that, having equal access to voting was only maybe like 55 years ago, we were able to, and I say we, meaning Black people, kind of had full agency to kind of even vote in our elections. It's like, that we're not as far advanced as we'd like to think. And the more that we try to deny our history, the more that we perpetuate it.
Yes. And there needs to be more discussion around women's reproductive
Hmm.
support, and
Hmm.
particularly for women of color, because to your point, that has been kind of put under the rug
Hmm.
with so many other
Hmm.
topics, and
Hmm.
sort of labeled
Hmm.
as, oh no, we've overcome that. But that
Right.
particular discussion has not really been elevated. You just hear about it in little bits and pieces, and really only if you search for it, truly. So your advocacy is very important. And I know that there's so many facets to this too, because let's move like into your life, into your present day. How has motherhood changed you? How has being a Black mom
Mhm.
changed your view
Uh,
in general about motherhood, if at all?
so first of all, I have to say I am obsessed with my son, and he is the most amazing being. And I know every parent says that. Never a day goes by, that I am not thankful for him and his spirit and his energy. and his innocence that I relish in, and also that pains me because I'm really scared as a Black mom for the day that he experiences or understands that he's experiencing racism or discrimination. And so that balance that I hold with knowing that I want to raise a little being who deserves every opportunity in life as as his friends, as any white person would. I mean, and he is half white, and but he will go through the world as someone who looks looks Black, and knowing that that's is going to be different in some ways. So it's changed me because I am, the anxiety that I had before has now shifted to a certain level of protection for him, and knowing that Black boys are treated differently in school. They're more likely to be, to have certain diagnoses and to be labeled, kind of troublemakers. And so I'm very cognizant right now as he is starting his school experience to figure out that environment. But yeah, it's so my heart is filled with so much love and fear, and of when we're going to have some of these conversations, and how I'm going to have to try to shape this experience for him, and buffer him and protect him, and also educate him about the realities of what it's going to be like for him as a Black boy to navigate the world, and as a young and Black man at some point. And I'm at that point where I'm having these conversations because we've actually already switched schools because of an experience where we had, like, there was just some very subtle microaggressions at preschool. So yeah, I would love to talk with her, and I think anytime I can find community with other parents that are navigating this to help temper my anxiety too, because I don't want to send them to school. I don't want to send them to school. I am, or we are, but yeah, that's where it's at. That's where we're at.
You're mama bear.
I
You
am
want to
Mama
protect
Bear.
your son. Well, of course. I
Yes.
mean,
Yes.
you're amazing as a therapist. You're clearly also amazing as a mom because you
Thank you.
care. And
Yes.
that's why your baby boy is going to be he's going to be amazing. I know it. He's
Thank
got
you.
incredible support.
Thank you.
And okay, so, it's funny because you've had a lot of experiences personally, professionally, and knowing what you know now, like, what would you do if you weren't a therapist?
That's a great question. There are two things that come to mind when I think about that. One is, I wonder if my dream when I started college was to become a psychiatrist. And I finished my master's degree. I actually toyed with the idea of getting a master's in communications, and with the idea of maybe I might become like a medical correspondent. And right now and I feel like that's changed, because I would actually love to take an extended sabbatical and just explore something creative. And I think I've really enjoyed pottery, and not that I would, maybe make a career out of it, but I just really love getting my hands into some clay. It's incredibly, kind of calming, very soothing, and I'm just really enjoying that. So that's what I would like to do. I think at this point, if I wasn't doing therapy, is just to maybe explore pottery for a bit and just see where that takes me. It's
Do
kind of
it.
random, but
No, it's not. I think that there are so many synergies where we may not see them right away. Like, to me, as soon as you say that, I'm like, sure. I feel like pottery would be very therapeutic. So perhaps there's some sort of segue eventually, or perhaps it's something that you do separately. You'll figure that
yeah,
out
I
when the
will.
time is right. And I encourage you to do whatever the hell you want. You've
Thank you.
earned that.
Thank you.
So I've asked you a lot of personal and professional questions, and it's all leading up to this moment. What would you do all over again, knowing what you know now?
I would have more grace for my struggles, and I would prioritize fun and joy in ways that I didn't before. Period.
And by prioritizing joy, and
Mm.
fun. What does that mean?
That means not telling myself I will do the fun thing after I do the work. It's making sure that maybe the fun thing needs to come before the work or during the work. And there's so many times that I delay, and there's a time to delay. I get that. Um, I think I went to the extreme and in ways that were not healthy, and people kind of still know me as this like workaholic, and I'm like, no, that's my compensation now for my ADHD. I feel like I have to work harder and longer. I needed more fun. I needed more fun. And so instead of studying on a Friday night or a Sunday or Saturday night when my friends were out, I needed to go out and have fun and go dancing and just be with them or go out to dinner and not say no to things that would have brought me joy and connection and community because I had thought I had to work.
So, saying yes to all of the experiences that would have brought you joy and
Yes.
community and
Yes.
happiness
Yes. And connection.
and
Yes.
connection. Do you have any parting words for our listeners today?
Remember who you are, lean into your strengths, and find joy. I think that might sound so cliche ish. And I think just knowing the ways in which and so many people that I know have prioritized work over living life and embracing life. And so I think live your life in a way that makes sense and feels good to you and not that's always, about living up to someone else's expectations of you.
I love that. Thank you so much for sharing. And thank you so
You're
much for joining me
welcome.
today.
Thank you. Thank you. I appreciate that. I appreciate that. Thank you for this
Thank you.
time and space.
Always. Thank you.